Hi, I'm James Janopaul-Naylor. I'm a PGY4 at Emory University Department of Radiation Oncology, and I'm going to talk today about how a virtual cadaver can facilitate abdominopelvic anatomy teaching. So the goal of this project was that interpreting CT abdomens are hard, and it can be difficult to link the human anatomy with the CT anatomy. Anatomy-focused sessions also can highlight oncologic principles of staging and treatment. What we did is we used an open source cadaver imaging set from the Visible Human project. This was a pilot study with 3 objectives: to identify abdominal organs and structures, to justify the use of contrast for different situations, and rationalize alternative visualization techniques such as MRI, endoscopy, and laparoscopy. These were predominantly preclinical medical students who participated. So what is the Visible Human project? Well, it's an open source software image set that you can use that we imported into our treatment planning software. So they have a CT image select and a slice of JPEGs that you can import into DICOM, and need a little bit of help with our physicist, Dr. Treatman. And what we have here on the right is the axial slicing of these images, but once it's in our treatment software, you can get coronal and sagittal reconstructions, which are pretty high fidelity. And this is what it looks like in our treatment planning software. As I said, it looks smooth, seamless in the coronal, sagittal, and axial planes. It's really helpful for identifying different organs and delineating them. And you can simultaneously see both the CT anatomy and the human cadaver anatomy. So I think this is kind of the crux of where it can be difficult, is these soft tissue interfaces, particularly around the pancreas, is some of the hardest anatomy to learn and to really be able to parse the differences. But when you have a cadaver imaging set, it's pretty easy. The pancreas just has a very different structure. You can pretty clearly see, and you also get to see some pretty cool things like the rugae in the stomach or the villi in the colon and small bowel. There is some of this blue formalin artifact that is from one of the preservatives, but it's pretty easy to recognize once you know what it is. It also goes into some of the blood vessels, as we see here in the descending aorta. So the students overall found this to be a very helpful session. We had 7 students attend our first pilot session. 5 responded to our survey about it, and uniformly the students thought it was moderately or very helpful as a session, and that it was, after the session, they were moderately or very confident in their ability to identify organs after the session. One of them even remarked to me he said, "I wish we had done this before our anatomy test on upper abdominal anatomy." 4 out of 5 students reported that the cadaver specifically helped them understand the CT anatomy, and that it was moderately or very helpful for 4 out of 5 students. So the takeaways I had from this session and putting together this project is that the human cadaver imaging can help facilitate CT-based anatomy teaching and understand the limitations of what these cross-sectional imaging can do. And it also helped identify, okay, what is the purpose of IV and PO contrast? When do you really need to see direct visualization, such as for, say, small colonic lesions when endoscopy is preferred, or when do you really need to get in there for a laparotomy? These are open access resources that might be able to complement a variety of undergraduate and graduate medical education. And I thank you for your time, and look forward to answering any questions and asynchronous. Thank you.